Hi, welcome back to my channel. I am Michelle Dia, your go-to girl for all things grad school and CFY related to SLP. And today we are going to be talking about your CFY, which I'm currently in my CFY. So I want to talk all things about it, including my own experience. Let's get started. If you're brand new to this whole SLP world, let me explain to you what CFY means. It stands for Clinical Fellowship Year. It is basically the transition from when you graduate from grad school into becoming a fully licensed SLP. It is usually a year. ASHA does say that you could take up to 4 years to complete your clinical fellowship year. So it does give you some wiggle room to complete it in case an emergency comes up and you have to pause it for a couple of months. So this is like a bridge year. You're still getting support, but you do not have professors anymore telling you exactly what to do or not being super nice sometimes. You are not by yourself, but you are also not being guided 24/7 because your supervisor might also be seeing other clients, other students, other patients. So you have your own caseload and you are getting paid. So that is the really amazing part of it, because I feel like in grad school, we go through all of these different clinicals and we're literally there for hours and hours in our clinicals, and we are actually paying to be there. I do want to say that it really depends on the supervisor based on how much help you're going to get that year. Because for example, my supervisor is in a totally different school and has like 50 students on her caseload and is not there in my school to guide me through stuff. So the support that she provides is very minimal, which in the beginning made me a little bit nervous because you're just fresh out of grad school and it's like, oh my gosh, like now I have to be the SLP and now I have to act like I know everything from beginning to end. And I was like freaking out at one point, but then you start to gain confidence in yourself and you're like, yeah, I know this. I provide the best possible therapy and answers as I possibly can. But if I am still not 100% sure, then I will tell the parent or tell the teacher, whoever has the concern, that I will get back to them once I reach out to my supervisor. Like 98% of the people that you're gonna be working with during your CFY, they don't know what a CFY or CF is. And many people do not understand that, so you have to advocate for yourself. To officially complete your CFY, you need to have a minimum of 1,260 hours that are supervised. That is what ASHA requires you to have when you are applying for your Cs, which I did make a TikTok about that. Cs stand for Certificate of Clinical Competency, and that's what shows that you are the SLP. Now let's talk about all of the different settings in which you could do your CFY. To start out, the most common one, schools. There's such a high demand for SLPs. I mean, I think there's a high demand everywhere, but in schools in today's day, I feel like there's multiple SLPs in schools. Now it's more common to see like 3, 4 SLPs per school. So I would say that schools is a big one. And if you're not interested in doing ARTIC or language, then how about skilled nursing facilities? That is another setting that is really high in demand. And you get to work with adults who have dementia, Alzheimer's, Parkinson's. You have 2 great options right there that are always hiring. Not to forget outpatient clinics, which can be pediatric or adult. I didn't have my experience in the pediatric outpatient clinic. I had it with the adults, and I was seeing patients who had Parkinson's disease, dementia, and dysphagia as well. We did a lot of dysphagia therapy, patients who previously had head and neck cancer surgeries and were now placed in outpatient clinics. I loved it. I just don't think the 60-minute therapy sessions are personally for me. But if you like it, then I would highly recommend. Now, hospitals might be a little bit trickier to get in coming out of grad school if you do not have a really strong medical base in grad school. So I would say to not beat yourself up for getting into a hospital right away coming out of grad school. There's always other little segues that you can take that will eventually lead you to the goal. You could, for example, take the little segue of going into a skilled nursing facility, or take the segue of going into an outpatient clinic or rehabilitation clinic as well, and you are seeing those type of patients that have dysphagia, dementia, aphasia, and you are completing those assessments at bedside that you would be completing in acute care. So I would say after your CF, then put all of the amazing things that you did in that medical setting during your CF, put them in your resume, and now your resume looks amazing. That when you apply to acute care setting, you have higher chance of getting in there than someone who hasn't had those experiences, if that makes sense. Or for example, if you really like the NICU, which I had one of my clinical placements there as well, I would say to keep on going that medical route, like acute care, outpatient clinics, and keep on doing dysphagia stuff. So when you do apply to that NICU setting that you really want, you have a strong dysphagia background and you'll be set to go for your dream job if that's what you want to do in the medical field. But if you don't, then you have all these other awesome options as well. Here are my tips for your CF. Apply to every SLP job that you see, whether that is in Indeed, ZipRecruiter, or also LinkedIn. If you don't have a LinkedIn account, go and make a LinkedIn account right now. Go and make a LinkedIn account. And if you need help, you can DM me on my TikTok or Instagram and I will help you with that, how to make it look a little bit more professional. I have a LinkedIn account that you could look at to get a little bit of an idea of how to set things up. Going back to it, apply to every job that you see. It doesn't matter if it says CFs accepted, CFs welcome, it doesn't matter. Apply to the job. Take your shot with every application. Second tip, build a good system early. I don't know if you have seen, but I have made a spreadsheet where you can track all of your CFY hours. If you do not have that spreadsheet, you can DM me, because it will save you so much time when it comes to knowing exactly where you are with your hours and when you can start your C's application, which is super important. Like, that's the whole purpose of doing a CFY. Tip number 3, connect with your CF mentor. I know some of them are not like the friendliest people on earth, therefore stay organized. But I would say that building those relationships, those connections can open other potential job doors. So I would say to build that good relationship with your CF mentor. Number 4, don't be afraid to say, I don't know, or I need to get back to you on this topic, or I need to get back to you with a better answer related to this, because we are learning. We just graduated from grad school. We do not know everything. Like, grad school was literally us drinking water from an open fire hydrant. So much information was given to us in 2 years. So we still have to process that information and get more experience with all of the notes that we have. Turn those notes into real life experiences. We're working towards that. So don't be afraid to say, I'll get back to you. People have to understand that this is our first year in the work field. So please give me a minute. Number 5, join fun SLP communities like this one. Whether you're on TikTok or Instagram, there are so many different SLPs that you can follow and just get different insights, different tips, you know, different experiences. I would say to keep up with that and kind of see what you like the most about different settings and what other people are saying about those settings, what other people are going through, what people have chosen for their settings. It is always great to follow what other people are doing, get a better understanding of like first person experience. It is okay to feel overwhelmed during your CFY. It is not an easy thing and you are thrown in at times. So do not feel like you're the only one. I've been there and I am currently still there. So do not worry. You're not alone. And if you have any questions, please reach out because I'm literally here to support you. You're gonna be learning so much every day about yourself and the SLP world. So be patient with yourself because you are becoming the best version that you can possibly be as an SLP. Thanks so much for watching. Don't forget to like, comment, and subscribe to my channel.